Since 1990, we have spent millions of euros and tens of thousands of research hours to find scientific answers to life's most important and challenging questions. What makes us happy? What makes us healthy? How can we heal from physical and mental disease? How can we heal emotionally and sexually so we can be happy in our relationships? How can we develop our talents and be of value to the world? We have interviewed more than 15,000 people and asked more than 4,000 different questions. After 20 years of intensive research, we are beginning to find the answers we have been looking for so long. We have already presented these answers in 250 research papers and about 30 books. Now we bring it over to you. In the Western world, 1 out of 3 or 4 experience to have a mental disorder. It's only a mental disorder when it's diagnosed as a mental disorder. But what is important for people is of course not the diagnosis, but the experience of not being well. So, in this clinical study, we asked people how they would rate their mental health. And if they rated their mental health as bad or very bad, then they were included in the study. So we included 54 patients who experience that they have severe mental problems, who rated themselves as having a bad or very bad mental health. And after the study was finished, after we have given them 20 sessions of clinical holistic medicine, which is talk therapy and, when necessary, touch therapy in combination, we could see that 31 now rated that they didn't experience to be mentally ill anymore. So a little more than half of these patients were cured with 20 sessions of holistic therapy. And it's important to say that almost all these patients were chronic patients. They had had mental problems for many years, and almost all of them had been treated by other doctors who didn't manage to help them. So, of course, many people have periods where they feel bad mentally, and we all know that these periods are often short, so people are, after 1 month or 3 months, they are well again. So the patients that we treated here were chronic patients, patients who normally felt that they were not mentally well. If you ask what helped them, what cured them, it's not so easy to say, because they had many different symptoms and many different problems. So it was like there was an individual journey for each of them. So it's not like the same is happening to all the patients. Quite opposite. Every patient has his own or her own journey towards understanding and health. But what you can say they have had in common was that they explored themselves and they came to a better understanding of themselves. And you can also say that there are themes that are always touched in the therapy, like love and your relationship with other people, your self-image, how you see and understand yourself, your sexuality, how you relate to your own gender and the opposite sex, your fundamental values of life, what you're good at, what you want to do in your life. These things are like always touched. So you can say that if you are to understand what is the source of the mental problems, it seems to be very much around self-image, about identity, about your understanding of yourself and life. It's important to say that the relatively low number in this study, about half the persons were helped, was because a substantial number of the patients dropped out of therapy, meaning they started but they didn't fulfill the therapy, or they didn't return the questionnaire in the end of the therapy, and all these are taken as non-responders to the therapy. We also made another study where we looked at the success rate if a patient actually completed the therapy and filled in the questionnaire, and then our success rate is 85% or better. But let's be conservative and say that this method can help about half the chronic patients who suffers from an experience of being mentally ill.